Hi, Mama. Welcome to Safemother.Safebaby. I am Yvette, your nurse midwife. Last week, we were talking about the common discomfort. Wait, was that last week? The other week, we talked about the common discomforts in pregnancy. And as promised, today we'll be talking about the danger signs in pregnancy. Now, when you hear danger, what comes to mind? Run, go, it's not safe, right? So these danger signs that I am going to be mentioning, if you experience them or if you see anyone who experience any pregnant woman who experiences these danger signs, please take them to the hospital as soon as possible. Or if you experience any of the danger signs, please go to the hospital as soon as you can. If you're in a setting where ambulance services are effective, you can call your healthcare provider or call the hospital so that they could get you to the hospital as soon as possible. The aim is to be able to seek care very early or seek healthcare services early enough. So whatever route is going to take you to the hospital fastest, please use it. Okay, so let's dive right into the danger signs. The first one that we'll be talking about is bleeding in pregnancy. Now, bleeding in pregnancy could mean that the placenta has either separated, which is placenta abruptio, or the placenta is coming before the baby, placenta previa, right? Those are medical terms that I'll not want to bore you with, but just bear in mind that if you're bleeding in pregnancy, then it's a sign that baby is either being derived from the core nutrients, so you should seek help as soon as you can. The second danger sign that we'll be talking about is reduced fetal movement or no fetal movements at all. Now, as I said in the last video, fetal movements start, or the baby starts kicking from the second trimester, and that's supposed to happen throughout pregnancy till you give birth. So if there's a day that you get up and you're like, seems like baby hasn't moved today, or the way baby is moving today, that's not how baby moves, and then you have to go to the hospital. Or firstly, take water and eat if you haven't, then lie on your left side and just observe for like 30 minutes to an hour. If there is no change in the fetal movements, then please go to the hospital as soon as you can. The third dangerous sign that we have to take note of is severe headache coupled with blurred vision. Okay, if you're having this in pregnancy, it could be a sign of preeclampsia. Okay, further tests will have to be done in the hospital to confirm this, but if you're experiencing severe headache, blurred visions, and your extremities are swollen, you have edema, please go to the hospital, because if preeclampsia is not handled early enough, it progresses to eclampsia. You're going to be having seizures in pregnancy, and when you're having seizures, baby is being deprived of oxygen, and we all know what that means, right? So please seek help if you're experiencing blurred visions and severe headache. The next danger sign that we are going to be talking about is severe abdominal pain. Severe abdominal pain, depending on the trimester, could mean different things. If it's in the first trimester, early in pregnancy, it could mean maybe an ectopic pregnancy. The baby is not implanted where they are supposed to be, okay, and that's a danger. It puts your life at risk, so you have to go to the hospital as soon as you can. If it's in the second or third trimester, it could be a sign of maybe an infection, a preterm labor, something has happened and baby is trying to come and it's not yet time. Okay, so you want to get that checked. The fifth danger sign that we are going to be talking about is amniotic fluid, the gush of amniotic fluid or leaking of amniotic fluid. Now, if it gushes out like water or it leaks, don't wait to say that I don't have contractions yet, I want contractions to come before I go to the hospital. No, the amniotic fluid is what protects the baby against infections, and you sitting around and waiting for contractions to come is you exposing the baby to more infections. So if it breaks, go to the hospital as soon as you can, and help us, dear mother, by noting the time that you noticed the amniotic fluid gush out and the color also. This is going to help the healthcare providers know what intervention to give you, how long the amniotic fluid has, or the baby has been exposed. And also the color helps us to know if maybe baby is in distress or not. Okay, so we would really appreciate this. And then the seed danger sign in pregnancy is severe vomiting. Now, in the last video, we mentioned that nausea and vomiting is normal, but then if it's severe, you would want to go to the hospital because baby is being deprived of nutrients, and even you too, you're dehydrated, so you want to go to the hospital so that you get replenished. Okay, so these are some of the danger signs in pregnancy. Not some, these are the danger signs in pregnancy that you want to know. And as I said, if you're in doubt, if you're not certain of anything, go to the hospital. Don't sit around waiting to say, no, I'm not sure. If I go to the hospital, maybe they'll send me back. Yeah, if they send you back, then you know that you and baby, you're fine, instead of sitting and just doubting. Okay, so I hope you were able to learn something from this video, and spread the news, share it to your loved ones, your caregivers, to other pregnant women you know, so that they can also learn a thing or two about danger signs in pregnancy. Okay, next week we're going to be talking about antenatal care, and I can't wait to see you all. Thank you so much for watching this video right up to the end. Bye.